Hello, everyone, and welcome to today's presentation. It's worth a shot. It is August 9th. And this afternoon, or I guess this morning, depending on where you are, the presentation will entail updates on National Healthcare and Safety Network, so NHSN updates, and review of the QSO-23-02-ALL memo by Lori Chikoyak from our account manager in Alaska. And then Shay Trafton is going to take the latter part of the presentation and we'll be reviewing the Mountain Pacific Tools and Resources website. So I will turn it over to Lori to go through some updates and reminders.
Thank you so much, Marcy, and I'm glad everyone is here today. I hope you all are having a fabulous day. If we can go to the next slide, please. Thank you. So just a couple of updates and reminders. Here's a couple of great links that you might want to try out and use the ever-changing pneumococcal vaccination recommendations with updated vaccines and new recommendations. It gets a little hard to determine if someone is actually due for a pneumococcal vaccination or not. This mobile app is really helpful. You put the information for the person into it. You enter their age, underlying health conditions, their vaccination history, that kind of thing. It doesn't get saved. They aren't storing data, but if you put the information in, it's like a little calculator. It's looking at all those factors, and it will provide you with a recommendation and answer if this is the vaccine you need, or you're up to date, or here's when you could be vaccinated and with what vaccine. So try it out. It's great. It's consistent with the current ACIP recommendations. So the latest recommendations they have are in use on that app. And then also there's current COVID-19 vaccination guidance that was put out on the immunize.org website on August 1st. So check that out as well. Next slide, please. And just a couple of housekeeping items. If you guys have something you would like us to discuss here on It's Worth a Shot on Wednesdays, we would love to hear your thoughts. So please toss in any webinar topics or clinician ideas. Just plop them right in the chat or email us. We are happy to add those in. We want to make sure we're meeting your needs. We are meeting every Wednesday. This is your time. I love this half hour. We pack in a lot of great information for you, and we hope it's very beneficial. It will be even more beneficial when we know we are producing topics for you that are useful. Now, and then before we go on to our next slide, I believe we have a polling question. Mary, could you go ahead and launch our polling question for the week? Great. Our polling question this week asks, do you order vaccines patient specific or as house supply? So if you guys wouldn't mind taking a second to respond to the poll, that would be great. Good. I see a lot of responses coming in. Awesome. Right now, I see a lot more overwhelming percent saying it's house supply. But we have a little bit of patient specific and then other. So if you have an other option, go ahead and put that in the chat as well. And I see we have someone who says it's dependent on the vaccine. Great. Give you a couple more seconds here. We've got about half of you have responded, so I really appreciate that. Thank you for tossing in your local situation. All right, let's go ahead and close that poll. It looks like at least 65% of you said it was house supply, and about 10% said it was patient specific. I apologize that I can't speak. And I see responses in the chat saying it depends on the vaccine, and it could be both, again, depending on the vaccine. So great, thank you so much for sharing. Next slide, please. Okay, so each week we want to provide you with an update on COVID-19, the hospitalizations, deaths, and ED visits. So here's the current information provided from the Centers for Disease Control. Our hospitalization numbers are up again this week. So they were up 12.1% in the past week. But the death rate is about the same. There's no real trending change. There is about a 1% increase, but it's kind of bouncing up and down a little. So it's pretty stable. And then you can see almost 150 million people, so 144 million some odd thousand have been vaccinated with the bivalent and are thus considered up to date with COVID-19 vaccinations. So woohoo, that's almost half of our population, which is great. Next slide, please. Tagging into this information, this is a map of our hospital admission levels, and this goes back to the 12.1% increase in hospital admissions. This map of the United States breaks down each county of every state and the information that they have reported out. As you can see, we've got a lot of color on this map. It's just not our beautiful looking map that was going on for a while. We definitely are in a COVID surge. So this is a great time to remember your best practices, making sure that everyone's up to date on their COVID-19 vaccine. And remember, up to date means having that bivalent booster. Making sure that you have good infection control practices in place. So everything from hand hygiene to source control when needed, make sure your policies and procedures are up to date. If you're having an outbreak, make sure your signage is up. And all of those really good practices that we've been using since the pandemic started. All right, next slide, please. Okay, and last week you guys had a question about who the representatives were for each of our states from the Center of Excellence for Behavioral Health in our nursing facilities. So we wanted to be sure and provide you with that information. You will get a link to the slides. We send that out weekly, so you'll see that, and it will be on our website as well. But just so you know, these are the representatives for each of our states for the Center of Excellence for Behavioral Health, and that was from our speaker last week. So I'm glad that we have people engaging in that. We definitely want to continue in the journey of good mental health. So, all right, next slide, please. And I'm going to take just a few minutes here and talk a little bit about a couple of things. QSO memos, this one in particular, but several actually overall, and some NHSN updates. And I'm Lori Chicoyak. I'm a nurse. I work at Mount Pacific, and I'm an infection preventionist by background. So that's who I am, just FYI. Next slide, please. Okay. Well, I have to say, as NHSN provided updates and did some webinars and things, this is their slide from one of those update webinars, and I love it. It is a great summary slide. As you guys know, in NHSN for our nursing homes, we have been reporting in these surveillance pathways. We've had that resident and facility impact, right? We've also had the staff and personnel impact, and we've had the therapeutics. So each of those pathways had required reporting in them. And I love it because you see all those black lines. Several of those sections have been removed. Therapeutics has been removed altogether. In addition to that, several other pieces of information are no longer reported. And that started with the last quarter of reporting. So this has been going on for over a month now, but we're no longer doing the flu section is completely gone. Testing availability, your questions on supplies and PPE shortages, that's all been done away with. When we look at the staff and personnel section, they removed the part that asks about COVID deaths. It doesn't ask about flu anymore again. It doesn't ask about staffing shortages. So none of those are being reported. The main change, and you might see on the left side there, the teal colored resident impact and facility capacity section. So when you do have a new positive test, there were a couple of additions. And that's those green plus signs in the bottom left of the screen. So if you do have a new positive case, it is asking about hospitalization status. So if you have a case, was the person hospitalized? And I'll, in a slide coming up, I'll show you a picture of that inside of NHSN and what that looks like. And then it also is asking about the up-to-date status of that individual. So let's say you have one resident who's positive for COVID-19. It's going to ask you a couple of questions. Is that person hospitalized? And are they up to date? And the up-to-date definition we're going to talk about as well in just a moment. Next slide, please. Okay, so I mentioned the definition change, and I really spoke to it earlier when we were talking about COVID-19. But the NHSN definition of up to date, which started with the third quarter, which began June 26th, because that week ended on July 2nd, which is the start of the third quarter technically. So you're considered up to date if you've gotten the bivalent vaccine or you are not due for a vaccine. And I expect that definition to change this fall when an updated vaccine is released. But that is the current NHSN definition. And I say that specifically because be sure that you're staying current with what the up-to-date definition is. I love it that inside NHSN, if you're wondering about that when you're entering your data, there's a little bar that says, here's the up-to-date definition. You click on it and it takes you to the page that gives you that up-to-date definition. So if you ever have questions about that, you can look it up right inside of NHSN. Let's look at a couple of the forms and how they've changed. Next slide, please. Okay, so this is the resident vaccination form. So each week, they've simplified that form. I talked about a lot of the stuff they took away. So it's very compact. And actually, if you think about it, when we had to report out those healthcare personnel flu shots, really our resident COVID and our staff COVID vaccination reporting kind of mimics that in a way. They want to know a total number of people who are eligible to be counted for the week. That's question 1. And really the rest of the questions, 2 and 3 has 3 parts to it. Those should add up to question 1's answer. So if you have 10 people that were eligible to be counted during that week, so that's number 1, then let's say the number of people who are up to date is 9. So we have one person that we need to put in. Let's say one person had a medical contraindication. You're going to put that on the 3.1 section. The other key to remember is when you're doing that, that also means we had no one who declined and no one that's in an unknown status. Be sure to put zeros in those sections. When you don't put zeros, it doesn't calculate correctly. One of the issues that NHSN encountered with the last update when they simplified this form is they had a quality issue, and many of you experienced that you got that little pink QA thing that popped up and it said, hey, you know, your data isn't right or you're missing data. And it was mostly on NHSN's end. They were connecting their old form in pieces that you guys were not entering on the current form, and they couldn't answer that because the information wasn't there to be had. So it is corrected now. You should not still be getting that question or that issue. If you are experiencing that, you need to reach out to NHSN at the help desk, let them know, take screenshots of what you're doing, and so that you can pass that on. So in short, just be sure that you're completing the section, every section of every question that's there. Be sure you save it before you jump over to doing the staff section or other sections in NHSN. Next slide, please. Okay, and the same thing for the staff side. Here's just a picture of what it looks like inside of NHSN. It's a little more complex because they're not asking for just a summary of everyone. They split everyone into a category. So just recognize that in each line, in each column, that it still needs to add up. So the total in one should be the same as in questions 3 and 4. So be sure that those are the same. And then it does ask one additional question that isn't asked in the resident section, and that is the question 2. And that asks who's completed a primary series, and it does give you a definition for that. Okay, so be sure again, if there's no one that meets the criteria in that section, be sure you have a 0 in it. Okay, I did put the question 2 information there on the slide as well, so you knew how to answer that question as you guys were coming upon it in case that was a question. Next slide, please. And just a couple of notes on logging in. To be sure you're in the correct section, when you log in and you have, I call it the banner bar on the left, that's the blue sections. Go to the COVID-19 section. It's easiest and best if you go to the pathway reporting. So if you click on COVID-19, then you're going to get the little pop-up. I put some arrows there, choose the pathway data reporting section. And then you're going to enter all the questions about the resident and staff and facility impact. Next slide, please. And this is the a screenshot actually in NHSN's test environment, so to speak. But I spoke to before, if you have a positive case, that this is where you would answer the additional questions on whether you're up to date or not with vaccination. So be sure that those are answered as well. Be sure if it's 0 that you put a 0 in there. Otherwise, you're going to have an issue with the quality of your data as it transfers over to CMS. Next slide, please. Now, that's the last slide I had about NHSN. Just a reminder to keep everything flowing with your data on a weekly basis. So every week, at least once a week, at least every 7 days, you need to be reporting. I am not
Lori?
sure. I want to just, yes, do we have questions
This is
about
Marcy. Yeah, Maria is asking, how about that point of care, the POC test result reporting?
That's a great question. So in some states, they are requiring that your point of care test results be put into NHSN. Many states are not doing that. I know Alaska isn't doing that. I can't speak to every state, but some states are requiring that if you do a test on site, that you enter that test with the person's information into NHSN. And if the state requires it, then you should put it in. But no, it is not required for CMS reporting. Okay, so that would be a state level requirement. Erica Baldry, thank you so much, Erica. She chatted in Montana, positive results are still reportable. But how you do that is up to you. NHSN is an option, but they have other options, the simple report and the form stack, and other reporting requirements. And that's positive results are still reportable in Montana. So great. Thank you for bringing that into the chat, Erica. I appreciate that. Great.
And then Maria's asking who in Hawaii would tell us if we need to keep using NHSN to report.
Yeah, I would reach out to your county Department of Health. I believe each county in Hawaii, if I remember correctly from our last HIPAA meeting, may be doing it a little differently. So check with your county Department of Health to be sure you're reporting your positives correctly, whether that's by a direct report, whether it's by NHSN or some other form. And I will double check on that too with them, and I'll let you know, Maria, to be sure. Okay, so let's move and switch gears here. I know it's already 12:50 and Shay still needs to speak. So really briefly, we do have some memo updates for you. Just some recent updates. That QSO 23-10, it's strengthened enforcement for infection control practices. I always like to talk about that as an infection preventionist. So be sure that all your great quality improvement activities are continuing, making sure you have strong infection control practices, because the enforcement, if you get a deficiency, the ante is up, so to speak. So stronger fines, there's a stronger requirement to work with your QIO. If you get a tag for something in infection control areas, so be aware of that. QSO 2039, it addresses visitation, and staff testing was also updated. So these are all things that have happened with the post public health emergency. And then it made it expire altogether. So QSO 23-02-ALL, it removed the staff requirement for COVID vaccine at all. It's just expired. Now, while the requirement is removed, that doesn't mean it's not best practice. And tagging on to that, I will also say, they also changed the language to make it up to date. So the language changed from just like, did they have any shot? Did they have a primary, series? Are they which is quote, fully vaccinated? So they did move that language to up to date, which I was happy to see, but they don't have that as a requirement anymore. And thus, because of that, also in the same memo, which they recently backdated. So at the end of July, they updated the memo to be reflective as effective June 5th, because it was supposed to take effect last week on the 4th of August, that surveyors are not going to assess for compliance when with vaccine requirements for COVID. So that is completely done with now. And then if we can move on to the next slide. Perfect, thank you. And then QSO 23-13, which came out in May, but I just wanted to put this on a slide as a reminder that it really summarizes a lot of changes post-COVID. It's a really great reference memo. I'm not going to go through each of those, but I just wanted to be sure and let you know that those are there. And next slide, please. So one brief thing, our infection prevention guide was recently updated. It's an awesome place, especially for new infection preventionists, to find, where you can put your local, state, national info, so many resources, and it just has them chock full in one place. And it has great links to guidance documents, to your state officials and, state departments of health and epidemiology. And so be sure that you download that and you utilize it for your infection preventionists and your leadership teams. It's an awesome tool. Okay, and the next slide, please. So just a brief resource slide, so you have the links to those memos and NHSN information. Next, please. And now I'm going to turn the time over to Shay Trafton. I wish I had the Wonder Woman theme queued up, because she is an amazing teammate, fabulous person to work with, and I'm so happy that she's here to present with us. And she's going to talk a little bit about navigating the Mountain Pacific website. Shay, take it away.
Hey, Lori. I'm sorry, Lori and Shay, this is Marcy.
Yes.
I'm wondering if Lori could just take that question in the chat from Jessica, our long-term care facilities still able to use antigen testing on residents?
Yeah, so that's a great question. And by expired, I'm assuming you mean since the memos have expired. And the simple answer to that question is, but you also need to remember that the CLIA waivers that were in place before expired. So be sure that the methodology you're using to test, if you're testing on site, matches your current CLIA requirements. But yes, you can definitely still use antigen testing. I love, and maybe it's a good time to toss in with respiratory season coming, Cepheid has a fabulous test that combines RSV, flu, and COVID. So if you have the capacity to do PCR testing, and because somebody has symptoms, but those symptoms could be multiple things, that's a great test to be able to kind of tease those out as well. So consider that as you're planning for testing when people have respiratory symptoms in your facility. And yeah, and I'll plop the name of that test in the chat. So thank you.
Thanks, Lori. So this is Shay Trafton. I am an account manager here in Montana for Mountain Pacific. My background is a bachelor's in science, master's in business administration, and I also am certified in human resources with the SHRM program. I wanted to reach out and let everyone know, one, not only do we have excellent employees with Mountain Pacific who have an abundant amount of knowledge, like Lori, but we also do reach out and show you guys a lot of resources that Mountain Pacific has. So with that, we kind of wanted to just briefly touch base and to show you guys and then highlight a few of our resources and where to find them. So next slide, please. So again, Mountain Pacific is a quality improvement organization, but we do, we are part of the direction of CMS. So we get a lot of, requirements through them to try to help you guys. We also partner with a lot of healthcare providers, practitioners, and different stakeholders within your communities and across our targeted region. And so we are here to help you guys as much as possible. So we want to make sure that you guys are meeting your measures, improving your quality improvement, and ultimately helping resident populations that you guys serve. So with that, again, these are just a few of the things that we offer. Our initiatives include preventing healthcare-associated infections in hospitals and nursing homes, preventing healthcare-acquired conditions related to long-term care in nursing homes, improving coordination of care from one healthcare setting to another. And as we look at that, that actually is becoming more and more of a focus for us. And we want to help you guys establish good connections with your local healthcare departments and other, providers in your area to help coordinate the care of our residents and our patients. So we improve cardiovascular health. We're looking at helping the health and well-being of people with diabetes, and helping providers use electronic health record. That's also things such as NHSN, which that's where Lori comes into play. She is an excellent resource for that. And then also just making sure that we're helping you kind of identify your data and help improve that and to make sure that it's useful for your facility. Next slide, please. So again, I'm not going to go through all of these, but you guys, we have a lot of excellent tools and resources on our website. These are just a few lists that we have. If you guys need anything, please reach out. Don't reinvent the wheel. We'd be more than happy to give you or to access these for you, to give you a link so you guys can download a lot of this information and then access any type of topics that we list here. Next slide, please. So this is a constant, or I guess not a constant, excuse me. This is a screen that'll pop up when you go to download a resource. Keep in mind that this is just to see for our purposes who is accessing it. We do not share this information forward. It just shows us kind of who is accessing our tools and resources. So when they ask you this, please do not be afraid that we're going to utilize your emails and share them forward. So you're going to get a bunch of spam emails. Next slide, please. So again, we are just one of many quality improvement organizations. And so we also, work with other quality improvement organizations across the US, and we can take resources from one another and we can share them as well. So if you guys are looking for something specific or you've seen it in a different webinar or out there on the web, please do not hesitate to reach out to us. We'd be more than happy to try to track down something either similar or that exact document or resource. So again, we have access to a lot of resources. We don't want you guys to spend time looking and sifting through things. We would love for you, you to reach out to us, and we would be willing to help you find that. Next slide, please. So again, here's a lot of our resources that we offer. Here's our corporate page where you can go and you can find a lot of our resources. There's plenty of tools and quality improvement resources. And then also just look at what other organizations we partner with. We work closely with Erica Baldry's team here and your HAI partners in your states. So again, please use us as much as possible. We're here to help. And that was kind of in a nutshell. I tried to keep it short and sweet, but if anybody has any questions, please feel free to ask. And I think if we don't have any questions, I guess we can, go back to the NHSN stuff. If anybody has any further questions on that, or the new QSO memo. We are at the top of the hour, so we don't want to take too much more of your time. So feel free to reach out either, with your account managers that you partner with Mountain Pacific, or even just, whoever you can get a hold of, that'd be great. Okay, well, thank you everyone for joining us today. We appreciate your time and we are here to help. So let us know if we can help you. Thank you and have a great rest of your week. Oh,
Thank you, everyone.
Yeah.
Just a reminder to fill out the evaluation form if you wouldn't. I think we put a link to that in the chat. Thank you, guys. And oh, Jessica had a question, so go ahead.
Yep.
Jessica, do you want to ask your question or do you want us to reach out to you offline? You're on mute if you're responding.
Lori, do you want to reach out to her offline? Jessica, can you pop your email in the chat for us?
Maybe I need to do further offline help. Jessica, I'm going to plot my email address in the chat. Why don't you email me? And I'll see if I can't help you with that. Okay. Give me 1 second here. I'm a slow typer sometimes. But just shoot me an email and I'll see if I can help you with that. Okay. And great, I got your email address too. So thank you all. Have a great day.